Guys, I'm going to settle this once and for all, the difference between a dietitian, a nutritionist, and a health coach. If you've ever wondered what one does differently from the other, what can a dietitian do that a health coach can't, and what's the career options for all three, I'm going to break it down for you. I've actually done all three of these in my career, so turn up the volume and pay attention. Welcome guys, I'm Amy Hager. I'm a registered dietitian in private practice up in the mountains in Colorado. So today I'm going to go over the three terms that I talked about: dietitian, nutritionist, and health coach. So first I'm going to go over registered dietitian. So that's the one that's the most regulated. It's the one where you need to get a 4-year degree at an accredited college in dietetics. You also need to pass a 9-month internship following your degree. It could be 9 months or it can be longer, but you're getting supervised practice in the field as a dietitian. And then after that is completed, you can sit for a national exam, and that's what gives you your credential as a registered dietitian, RD. Some places call it registered dietitian nutritionist. And then once you have your registered dietitian credential, you're legally allowed to go and medically treat someone for a disease state using diet. That's why registered dietitian is the most protected and the most regulated. Not everyone is legally allowed to prescribe a diet to help treat a medical condition. It's definitely reserved for dietitians. So what can you do as a dietitian? Where can you work? Well, in your baseline training, you get trained in food systems. So you could work in the restaurant industry. You could work at institutions like school systems, even prison systems, any institution that has a food service, including hospitals. So anywhere, any organization that employs a really big food system service might employ a dietitian. That's the food angle. You might work in a clinical setting. So another option is that you could work in a clinical setting like a hospital or a clinic where you're actually in front of patients and you're giving them advice as to how to improve their disease state with diet. Now, there's one more area that gets a lot of focus in the school and in the training that you do as a dietitian, and that's a community setting. A lot of times these are more educational positions where you're educating the public, you're working in programs where you're doing a lot of education and outreach into the community. But then you're not limited with those three areas. You could also work in academics. You might work as a professor teaching nutrition. You might be more of an entrepreneur and decide to work for yourself. And you might have the opportunity to partner with sports teams or brands or food companies or supplements. And there's a lot that you can do in those areas as well. But these are just kind of touching on some of the topics where you might be able to work as a dietitian. You definitely have the most options as a dietitian. It opens up the entire field for you in food, in diet, and working with people in nutrition. It definitely gives you the most options, opens the most doors, and you'll see the most job listings for a registered dietitian. We talked about dietitian being the most regulated. In fact, many states don't let you use the word dietitian unless you have the credential as an RD. But a lot of states are lax on the use of the word nutritionist. You might be able to be a nutritionist like you can in Colorado without necessarily having any kind of training. There's no regulation to the term. Someone can say, I'm a nutritionist, open up for a business, and there's nothing really behind that term that's required legally. So people can become a nutritionist with a certification course. People might take a college class. They might have a 4-year degree, but the word nutritionist, especially in the state of Colorado or other states that are unregulated with that term, don't guarantee the amount of education or training that someone has had by calling themselves a nutritionist. So that's very important to understand. Some states really regulate the term. When I was living in North Carolina, you couldn't call yourself a nutritionist unless you were already a dietitian. So it was dietitian, nutritionist combined. So they really regulated it and protected it for people that had the same training as a dietitian. So what can a nutritionist do? Well, it definitely comes down to what's allowed in your state. What are the regulations allowing? You might be able to counsel clients, but what's reserved for dietitians is that medical nutrition therapy, treating a disease state with diet advice. That's really for the dietitian. A nutritionist should not be doing that. But a nutritionist can absolutely provide guidance in general health terms. A nutritionist can educate. And this is something I was doing when I graduated from my 4-year degree, but I hadn't done my internship yet. So I wasn't a dietitian yet. But I had this 4-year degree. So what I found myself doing was working for a company that sold supplements. So I was making sales on the phone, educating the buyers about what our new supplements were, what they could do, what kind of benefits you would get. And that's something completely within my scope of practice as a nutritionist without being a registered dietitian. Now, a lot of people can work as a nutritionist and work with clients as long as they don't cross the boundary of providing medical nutrition therapy to patients or their clients. They don't want to be treating a disease state with the diet. But if they want to give meal ideas or recipe ideas or health coach guidance on like how to set goals and how to eat healthier, that's absolutely within their rights to do so. So let's get to the last one. Let's get to health coach. You also might hear coach or nutrition coach, but using the word coach is kind of more, it's a little bit more of a newer term compared to nutritionist, but it's basically indicating someone that's helping you make behavior change. So the focus is on you changing your behavior, maybe coming up with a plan or a long-term goal or an overall vision, and really working on strategies to help you change up your behavior. It might be nutrition focused, it might not be. It might be focused more on exercise, or it might be focused more on sleep habits or other, maybe stress reduction. So a health coach can be pretty broad, but the scope of practice for a health coach is that you're focused on the change and setting up goals for your client, not necessarily telling them what to do. Coaching is more of a guidance where you're helping people see what they want to do and helping them get there. So the strategy is a little bit more client driven than it is expert driven. You don't want to necessarily just be giving advice to help people solve their problems. You want to show them how they can achieve those on their own. It's a little bit of a different approach as a health coach, but a lot of times you'll find health coaches are registered dietitians, or they're registered nurses, or they're personal trainers. A lot of times to be a health coach, you've gone through a training, a specific training for coaching to help you learn the techniques of coaching. So it can be a really great blend. But what if you're just a coach without a dietitian credential or a registered nurse credential? What kind of career expectations can you have? So a lot of times you'll find health coaches in roles where maybe they're working for an insurance company and they are calling up the members of the insurance company and seeing how they're doing with their healthy eating or their healthy exercise plan, and the coach goes in to make regular contact and create accountability for the patient. You're usually going to be in a role where you're working for somebody else, or if you're working for yourself, you're going to be, it can be wide open. You know, it can be, the topics can be anything from nutrition to exercise to stress management to sleep improvement. So it can be pretty holistic to be a health coach. But one thing that separates the health coach, the dietitian, and the nutritionist is one option that dietitians have that the other two do not, and that is the ability to work with and partner with insurance companies to be able to bill for your services. So this opens up a whole nother door for dietitians and a career option to be able to be self-employed, because usually the rate for reimbursement with partnering with an insurance company is about 3 to 4 times the hourly wage that a dietitian might make in a salaried job. So there's definitely more income potential there depending on how many clients that you have or you want to work with that take insurance. And the other thing that comes up when you're talking about being a dietitian or a nutritionist or a health coach, in addition to the amount of school and the amount of training that you need, is how can you work in your local area? Like what kind of regulations are in place? So the most regulations will be around being a dietitian, but it also has the most opportunity associated with it. You can really be your own boss, especially if you do work with the insurance companies. You are trusted as a health professional to deliver a professional service, and you are reimbursed as such. Now, health coaching, you are seeing health coaching being reimbursed as a service through some insurance companies, but usually it's usually that happens under the supervision of another provider like a physician. So right now, health coaches are not able to bill insurance companies for their services, but the service of health coaching can be billable under, if you're working under a doctor or another healthcare provider that's able to bill those codes. Now, a nutritionist is not able to bill insurance, not in the United States, but definitely all three areas are very useful and very helpful to help people make changes in their diet and be able to be supported as they're going through those changes. So, and if you're interested in those areas, drop a comment below and I can definitely give you some feedback about what it's like to get training as a dietitian and a health coach, since I did do both of those fields. So hopefully that provides a little bit of clarity as far as the difference between dietitian, nutritionist, and health coach, and what you're able to do in work, in a career option as far as each of those areas goes. And if you're also considering working with a dietitian or a health coach, maybe figuring out the difference between the two and what you might expect between working with a dietitian versus working with a health coach. So if you're considering any of those options, drop me a comment below, ask me a question. I've done both routes, the dietitian and the health coach, so I'd be happy to answer any questions that you have. And if you feel like you learned something today, give me a thumbs up on the video. All right, guys, take care. Bye.